Hi, Mrs. LP. I'm Patty, your nurse practitioner here at Duke.
Hi, good to see you again.
Good. How are you doing?
I'm doing okay. I'm just here for my checkup after my cholesterol check that I had last week.
Yes, exactly. So how are those lifestyle modifications going that we talked about?
They're going okay. I'm still having trouble eating less red meat and cooking more vegetables. I'm just not sure how to do that yet. But I have been able to exercise about 30 minutes a day. I like to go walking. So.
Wonderful. Well, that's good. The increase in exercise is really great, and I hope you can keep up doing that and maybe even increase the time. And as far as the dieting and the change in your eating habits, I can set you up with a nutritionist who can give you some really good ideas about making substitutions and making healthier lifestyle choices.
Okay, that'd be great. Thank you.
Yeah, and even with your diabetes, that would be really good too. And which leads me into how's the diabetes management and the insulin regimen going?
I have been able to do the insulin regimen, so that's going well. But again, it would be helpful if I could have some help with my diet. I think that would just help me work that out even better.
Great. And are you able to use the insulin a little bit better?
Yes, I think I've gotten used to giving myself the shots, so.
That's really good. Well, I went over your lab results, and your cholesterol levels have gone down a little bit. Not enough that I feel comfortable with it, but what I'd like to do is put you on a drug, which is a statin, and it's for maintaining high cholesterol. In order to do so, I want to get a sample of your DNA, and I know that sounds odd, but I want to see if you're at risk for one of the common side effects for the drugs. Would that be okay?
Well, could you tell me more about that first? I'm just not sure.
Absolutely. That is what I'm here to discuss with you today. So to start, do you know what genetic testing is?
Well, I mean, I've heard about the direct-to-consumer companies on TV and stuff, but I haven't really participated in any of that.
Okay. Well, first I'll explain what the test is and what kind of drug that we're going to be putting you on. It's called Simvastatin, and specifically, this drug is a medication that slows cholesterol being made in your body. So if we can slow the amount of it, we can potentially reduce the amount of buildup in the arterial walls of the blood vessels in your body. And it's one of the first line drugs that we use after diet and exercise modification.
Okay.
So Simvastatin is also used to reduce heart attack, the risk of heart attack, strokes, and decrease during the risk for cardiac surgery. And that's what I was talking about with the slowing the cholesterol. So what it's going to do is reduce the plaque buildup in the arterial walls. So these are really good drugs that help with that.
Okay.
And you're probably wondering when you're going to take it and what it looks like.
What would be added to my medication regimen?
So it's pretty easy. The nice thing is it comes in tablet form, so you would take it at nighttime. And the reason why we say at night is because your liver is most active then, and this drug is metabolized by your liver.
Oh, okay.
And you also want to avoid drinking alcohol or taking anything really acidic like grapefruit juice with it.
Okay.
So with most drugs, I like to go over the side effects and the adverse effects for patients.
That would be good.
You may not experience any of them, but I like to let patients know just in case of the side effects being bad, that they need to go see a doctor because they persist too long, or the adverse effects occur and then you need to go to the hospital immediately to get checked out by a physician or another nurse practitioner.
Okay.
The lesser side effects, so if they happen for a while and they just keep staying and they're persisting and they're annoying, are constipation, stomach pain, nausea, headaches, memory loss, maybe a little forgetfulness or confusion.
Okay.
And lastly, you might see some muscle pain, which is one of the reasons why we're going to be doing the test today, because this is one of the DNA test. It will indicate if you're at risk for the muscle pain. There have been trials done that show certain people have a type of trait that increases your likelihood of that.
Okay, wow, that's a lot to take in.
I do have a brochure for you that I will give to you on the way out that you can
Okay.
keep with you so that you have a list of anything that you can refer back to.
Like the information on the drug. Okay.
Exactly.
That'd be good.
And I'll have more details that will go into it and have a website for you to have more information as well.
Okay, great.
And of course, you can always call the office and ask us questions if you need to.
Great. So could you tell me more about the DNA part of this?
Sure. So first what we'll do is we'll take a little bit of blood as a sample and we'll send it to a lab. The lab has a certification. It's called CLIA. It doesn't really mean anything for the patient, but it just means that the test is being done in a lab that meets certain standards and is a certified lab. So it's has very strict standards that it upholds. The sample is target analysis, so that means it's being used directly for this one drug that we're going to be potentially using for you. And the test is a 99% specificity and sensitivity, so that means it's going to be very accurate in testing whether your blood is going to be at risk for this risk factor.
Okay, that makes me feel better.
Yeah. So the test, as I said before, we're looking for is this muscle pain and weakness. It's called myopathy, and it's where the muscle fibers in your body might not work, or they tend to get tired and very weak. And there's, so when I get into this allele thing that I'm going to explain to you, basically you're going to have either a variant called TT, which is the normal variant, TC or CC. So what those mean, if you have a TC or a CC allele variant, it means you're at risk.
Okay.
So if you're the TT variant, it doesn't mean, it means you're normal and that you have what's called the wild type, so you wouldn't be at risk for this myopathy.
Okay, but someone would be there to explain the results with me.
Exactly, right. And then if you are Caucasian or Asian, which you are, Mrs. LP, you might be might be one of the persons who has either the TC or the CC variant. But again, I would go over that with you.
Okay, so it's more common in Caucasians?
In Asian, yes, exactly. So the next thing, we want to make sure that it's working well with your genetic and body type. So while you're on the drug, we would regularly test your liver.
Okay.
We test liver function, and then we'd make sure that all the rest of your medications are compatible with Simvastatin. So that means none of them would be contraindicated, especially if they were a certain type of inhibitor that wouldn't allow the medication to be absorbed in your body or metabolized properly by your liver.
Okay, I'm just a little worried about the cost adding to my insulin regimen.
So Simvastatin is a generic, which is great. So it's usually, you can get about $5, it's about $5 a month at Walmart or Target. And because it is a generic now, it is a lot cheaper, which is really good.
Okay, that's great.
Yeah. And we'd probably start you out at a 20 milligram dose. If needed, we could bump it up to 40. This would be if you're not at risk for that allele variant we talked about, but we would keep you under 80 milligrams.
Okay. Well, it seems like it would be okay, especially if it's one of the $5 medications I could get at Walmart.
Yeah,
so.
And I understand with all the diabetes medications and everything, it can get really expensive every month. So it's a good thing that this drug is on generic right now. And it must be really hard for you, especially since you have 3 children and you're running around like crazy all the time.
It is a lot to manage, but.
Yeah, and this is an easier drug to take. It's only once a day at nighttime right before you go to bed. So if you leave it next to your bedside table, probably really easy to take at night.
Okay.
So if you do test positive for the variant, there are other drugs that we can give you that are similar to Simvastatin, but don't have that risk factor that we talked about. We can put you on an aspirin regimen or give you bile acid sequestrants. These are all different drugs that we have. And we can continue to work with your diet and exercise modifications.
Okay, so I'll do the DNA test and then have a follow-up appointment to
Exactly.
talk about the results. Okay,
Right.
That makes me feel better.
Yeah, and I on the way out I have the brochure and some more information for you about that DNA test. It's a little bit more of the scientific end of it, but it's a good review. So.
Well, thank you for going through all that with me.
You're very welcome. I also have a little questionnaire for you to fill out, just so that I can know that you understand everything we talked about today. And I'll get you that referral for the nutritionist.
Great. Thank you so much.
Thank you. Have a great day.
You too.